Good day, and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deschebert Schuster, State Director of AARP in this territory. And today, as we are in the month of September, we recognize that this is Prostate Cancer Month. And so we have with us some very special guests from the American Cancer Society. First, we have Dr. Lillian Santos, who's the Executive Vice President of the American Cancer Society of Puerto Rico. And also, we have with us Denise Molfuyeda, who is the Puerto Rico USVI liaison of the American Cancer Society Incorporated Southeast Region. Good day. Welcome to the show.
Hi, it's very happy to be here with you today.
Thank
It,
you.
Thank you. It is wonderful to see both of you again. I saw you all here on St. Croix earlier this year as you
Yes.
were making those plans for the Relay for Life, the American Cancer Society Relay for Life. Unfortunately, that had to be delayed because of COVID-19.
Yeah.
But I got to know both of you during your time here, and we thought it would be so wonderful to develop this new partnership between AARP Virgin Islands and the American Cancer Society, and to have both of you on the show today to bring us very important information about prostate cancer in particular.
Mhm.
But before we get into those details, tell us more about your role at ACS, sorry, the American Cancer Society. Starting with you, Lillian. Tell us what you do exactly.
Well, I've been proud to be the executive vice president for the American Cancer Society for the last 24 years. For many years, I was overseeing also our fight against cancer in Virgin Islands, and now I'm partnering with the Southeast region and helping and facilitating our cancer control initiatives and patient services in USVI. I'm a clinical psychologist as a professional, but my passion is to help people and to save lives. And that's what I have dedicated my life for the last 24 years. And the American Cancer Society has been a place where I'm very proud that we could make a difference in people's lives.
Great, thank you. And Denise, tell us about your role at the American Cancer Society.
Sure. I actually have the very special privilege of working with so many dedicated volunteers that we have on USVI. Um, uh, Hurricanes when we had our offices there, and unfortunately, the physical offices had to be closed, but we're very fortunate to have um, a army of volunteers that work very hard to keep the ACS mission alive. So I work with them, and I also have the privilege of working with Puerto Rico and how it all ties in together with corporate American Cancer Society or National American Cancer Society here.
Wonderful. And you mentioned that the office here in the Virgin Islands offices, because there was one in St. Thomas and a smaller office in St. Croix, that those are closed since Hurricane Maria.
Yeah.
But I assume that the American Cancer Society still provides services here in the Virgin Islands. Am I correct?
Yes.
Yes, that is correct. We partner up with other cancer organizations, with local providers. Um, as a matter of fact, next month there's going to be a mammogram program, a free screening mammogram program where we provide grants to Juan Luis Hospital, to Schneider Medical Center, and also to St. Thomas Radiology. Anybody that wants to take advantage of that can call them and sign up for those programs. We also provide financial assistance. So we have 800 number. We have our volunteers on the ground that are also very available to help you reach us. So we're very much present in the community in all of USVI, in all of the territory.
That's wonderful, and those services are so needed here. We have so many people,
Yeah.
especially I've been hearing that there's a very high incidence of cancer on the island of St. Croix. Have you heard any of those differences from your perspective between St. Croix, St. Thomas, St. John? Would you say there is a higher rate of cancer on St. Croix?
Well, actually, we have information that we learned when we had a recent visit to Virgin Islands through the cancer registry. And we're happy to share that now we could target our initiatives and our services because there's data in place. And the number one incidence in men is prostate. They don't have a difference yet between islands. However, that we could not determine the differences between St. Thomas, St. Croix, but it's so important to have information. We didn't have data before. Now we do have data that provide us a blueprint of where should we be targeting our services and where we should be supporting the Virgin Islands. And when we are here, the American Cancer Society exists not only for cancer patients, and I want to get that message across. We are here to serve the community at whole, because we're here to prevent it, to early detect it, to educate the people when they have to face a diagnosis, and we are there to support the caregivers also. And we want to partner also with government officials to promote advocacy and public policy that would impact the public health in the islands also. So I wanted to mention something, Troy. You said something about COVID, and COVID stopped the world, stopped everything, but unfortunately, it did not stop cancer. And that's why the American Cancer Society has continued, not stopped, providing services. It doesn't matter that Hurricane Maria came. Doesn't matter that we don't have offices. We have people that need us there. We have volunteers supporting the American Cancer Society, based out of Atlanta. It's a global organization that's been in place for more than 100 years. And we have not stopped doing our research, providing the services. And there's a lot of many things that could be happening, but we are aware that cancer doesn't stop. So we won't stop doing what we need to do to support our patients, our caregivers, and to partner with people like you. So I want to start by saying thank you so much for partnering with AARP, because you have a population that you serve. Your membership is the people we want to speak to today. Why? Because we want you to take charge of your health and action plan. We don't want to be like with the awareness only. We want you to take action and put an agenda and make sure that you are taking care of yourself. People take care of everybody else, but you have to take care of yourself. So for us, it's very important that our mission is accomplished, not only through providing the services that we are doing and partnering with people like the Cancer Registry, AARP, the Cancer Center, but we also have our mission priorities, which is research. We are the non-governmental organization that invests more in research. And research is important. 47 Nobel Prizes says the pap test in women, tamoxifen, the chemotherapy now is oral chemotherapy, a lot of them instead of more aggressive treatment. So there's a lot of things, advancements in treatment and in early detection that is really helping us to support the fight against cancer. So research for American Cancer Society globally is very important. As I said, prevention and early detection is crucial to save lives. The earlier you detect cancer, the better survivorship you're going to have. We're not going to forget about access to care. We have a lot of people underserved, uninsured, and that's why public policy and advocacy is so important. We need equity. We want to work with disparities. And when we speak about disparities, we know that minorities has more of a prevalence and incidence of cancer, and unfortunately, and they are diagnosed in a later stage. So when I speak about minorities, I speak about African American. When I speak about Hispanics, and by the way, this is also Hispanic Heritage Month. So Let me say hola to all my Hispanic friends in the Virgin Islands. But going back to the prostate cancer, it's very important that we message them, and now we're messaging them not only because we thought it was important in the African American community and Hispanics and minority, but now we have data. The Cancer Registry says that unfortunately 136 people are dying of cancer annually. The Cancer Registry of USVI has diagnosed 141. Number one, cancer, the most cancer diagnosis, prostate is 141 annually. And colon cancer is second in men. And third is blood and lymph nodes. So we now know where we have to message, and in women it's breast, uterus, and colon. So I'm very happy to be here in our first interview and information, providing information to prostate cancer, not because it's September only, it's because that's the the #1 incidence cancer in the USVI. So I wanted to share with you on some, who better than men talking among them about this topic. And sometimes men don't like to speak about this. They don't like to speak about the digital rectal exam. They don't like to talk about the blood test, but this is something they need to speak about. And I want to share a video that we're going to see men speaking about prostate cancer and how they could approach the prevention and early detection of this.
Okay, great. I'll cue that video up right now.
All right. It's come to my attention that one of us is now officially an old man.
Hey, watch it, man.
Seriously, Bill, happy birthday.
Thanks, guys.
Happy birthday.
It's going to be a great year.
Oh, yeah? What you got planned? A trip down to the old folks' home?
Is that before or after your tea time? Huh?
Now, really, are you and Linda going to take your regular trip to Europe?
Well, if I pass all my tests, actually, we're thinking about taking the grandkids along.
The test, wait a minute. They have SATs for old age?
There you go. There you go. No, man, I got my annual physical next week at my doctor's office. Supposed to be a good one. We're going to do blood pressure, cholesterol, colon, and prostate.
Dude, we're eating. No talk of prostates and colons, please.
Oh, come on, man. You don't want to think about the old love up test? Huh?
Now, actually, guys.
Here we go, guys. Doctor's going to educate us.
Well, the reality is that there are some tests that you definitely want to have when you hit a certain age. But it turns out that prostate cancer testing doesn't necessarily fall into that automatic no-brainer category.
Hold up. Well, why is prostate cancer different? I thought catching cancer early was always a good thing.
Well, the deal is that prostate cancer is not just one disease. Not all prostate cancers are the same. Some prostate cancers grow very fast and can spread and cause a lot of harm and even kill men. But other prostate cancers grow very slowly. And those slow-growing cancers may not ever harm that man. As a matter of fact, if he didn't have that screening, he'd never know he had cancer. The big challenge is that the tests that we use to look for prostate cancer don't always tell us if it's a fast grower or a slow grower. So a lot of men end up being diagnosed with those slow growing cancers, and they end up with unnecessary treatment. And treatment can have some complications.
Don't know if I'd want to go through all that, if it was slow growing and probably wouldn't do me any harm.
Shoot, I wouldn't care about side effects. If they find cancer anywhere, I want it out.
Well, and that's exactly why the American Cancer Society recommends that men learn everything they can about both the good and the bad aspects of prostate cancer screening, and then make a decision along with their doctor about what's best for them.
Did you know they found prostate cancer on my exam last year?
What? Dang, man, why didn't you say something?
Well, look, based on my test results, it looks like I just have the slow-growing prostate cancer. So,
that's good.
My doctor and I agreed that we wouldn't rush into any sort of treatments, so we're just monitoring it right now.
Glad you're okay.
Yeah,
Definitely.
Hey, look, guys, I know I got a prostate, but it's kind of like my appendix. I know I have one of them too, but I have no idea what it does or how it can get cancer.
The prostate gland sits at the base of your bladder, and it makes the fluids that men use during sex. The main risk for getting prostate cancer is age. The older you get, the greater your risk of getting the disease. But also, being African American increases your risk, or if you have a father or a brother who has prostate cancer, your risk is higher also.
So how many guys are actually diagnosed with prostate cancer?
Well, if you look at 100 men who are 50 right now, about 17 of those men will be diagnosed with prostate cancer over the rest of their life. But only about 3 out of those 100 men are going to die of prostate cancer.
Are there any symptoms?
Well, early prostate cancer actually doesn't have any symptoms, but you can find men who have problems either passing their urine, getting it started or stopped. Men might have to start getting up a lot during the night. Sometimes you can have pain with urination or blood in the urine. If you're having any of those kind of symptoms, you need to call your doctor and get in and get checked out right away.
Well, Bill, I'm thinking I'm going to at least get tested. Now, since you're an old pro, what can I expect from my test?
It's not that bad, really. There's 2 tests. The blood test is the most important one. So if you're going to get one, that's the test you want to get. And it's pretty easy. They just measure your PSA.
That's prostate-specific antigen, not public services.
We got a regular comedian over here, huh? You just see how much of it is in your blood. And the other way is the old glove finger in the backside.
Ooh.
Now, for a lot of men, they just can't get over the idea of having that finger test. So if you're only going to have one test, the blood test alone actually works pretty well.
Sounds like the bottom line is talk to your doctor and decide whether testing for prostate cancer is right for you.
Bottom line. Really, man?
All right.
Well, look, doc, I'm thinking I'm going to get tested. Now, if it comes back normal, does that mean I can quit worrying about prostate cancer from now on?
Well, the best way to find the disease early, if you're going to be tested, is you need to get retested every year or two. And even for someone like Chris, who may decide that they don't want to get tested right now, you need to revisit that decision sometime in the future. Things change. There's new science that develops, or you might have a family member who's diagnosed with prostate cancer, and that might push you in a new direction. So think about it.
Makes sense. Well, good luck, Mel.
Hey, thanks, guys.
And by the way, you guys got that catch the other night? Did you see that?
Oh, man.
That was
And save them.
beautiful.
Well, I think that was excellent, to listen to them, to speak about them, and I cannot stress enough that our American Cancer Society is the one that creates all the screening guidelines worldwide and the most quoted source of information. And what is different now than in the past is we used to say when you turn 40, you have to go for that prostate cancer test. Now the conversation is between you and your doctor. It's not a guideline that you need to go at 40. Now it all depends on your history. If you have family members, first degree blood, father, brother that has had cancer, prostate cancer, you need to have that conversation earlier, maybe at 40, at 45. When you turn 50, if you get a diagnosis of cancer and your expectation of life is 10 more years, you have to definitely, like, for example, if you're 80 something, says 80% of men that reach 80 years old or more, 80% most probably would get diagnosed with prostate cancer. That doesn't mean that you have to go and rush and do surgery or do treatment, because your life expectancy is going to be 10 more years. So why even bother? You have to monitor it, speak to your doctor, and make sure that it's not causing you any, effects that are limiting your quality of life. However, this is our conversations that you need to have, not only among friends like they were having. It was good that somebody said, let's speak about it.
Right.
But it's very important you have with your doctor.
Well, there's such a stigma attached to cancer in general. So many people, I find, even right here in the Virgin Islands, act as though cancer is some kind of bacteria or some kind of virus you contract, that you pick up, and it's almost like a shame to have cancer. But everybody needs to realize that cancer is part of us. They are our own cells that have mutated and are growing out of control. It isn't like we came in contact with somebody and caught it in some clandestine or awful way. It is part of our body. I myself am a cancer survivor. You mentioned that lymphoma is the third highest in the Virgin Islands. Well, I had lymphoma. I was stage 4 when I was diagnosed, and here I am about 10 years later. There's no trace of cancer left in my body after going through 6 months of chemotherapy. It turns out that my father died of a very similar type of lymphoma. I had Hodgkin's lymphoma, he had non-Hodgkin's lymphoma. Just as I was recovering from cancer, he was diagnosed with cancer, and he succumbed to the disease. But we need to get past that stigma, and especially for men to get past the stigma of prostate cancer. They act almost as though it's something like a death sentence or some kind of awful disease that you can spread. And again, for many, many men, they worry about impotency. So tell us a
Yes.
little bit about the outcomes that you're seeing these days of men who go through prostate cancer treatment.
Well, we know now that in the past it was being overdiagnosed and maybe overtreated. That's why these conversations are very important to acknowledge and see what staging is it. Um, there's several secondary effects that could come with this. Um, and I know that men are thinking the impotency, that it does not have to be permanent. We have seen that the survivorship, the incidence of survivorship has been higher every time. And the earlier it's diagnosed, the most, the prognosis is much better. So it is important that we speak about it. And one of the things I said in the video, very important, is that sometimes we just have to go for the screening and for the testing as a preventive tool because it's asymptomatic. Sometimes you don't even have symptoms. So it's important that people know. You said it's a stigma, and that's true. You know, cancer is not a death sentence any longer. We are working with the topic and this condition in a most hopeful period in history of time. When I started working for the American Cancer Society 25 years ago, I could not stand here and say that even though we are listening that people are having more cancer, the incidence of cancer might be here higher. It's not that it's higher. People are making sure they're going for their clinical exams. There's more centers of radiology. There are more access to service. Our population is also getting older, and there's a correlation between age and cancer. But people are surviving more than ever, thanks to research, thanks to early detection, thanks to the messaging and the education that we're having. And going back to your initial question, prostate cancer, yes, now we're diagnosing, we're making sure that we're early diagnosing detecting the cancer. So definitely survivorship is more. And we realized many years ago, that's why there was a modification in the guidelines that you not every time you have prostate cancer, you don't have to do surgery. Not every time you have to have the secondary effects of of impotency, or that sometimes it's just temporary. And there's a lot of things and advancements in regards to the treatment and less aggressive than in the past.
Excellent.
So
Now, in these times of COVID-19, it is very hard for us to come into contact with each other socially. So I would imagine that it would be a challenge for the American Cancer Society to reach out to people and for people to get in touch with the American Cancer Society. So Denise, tell us a little bit about how people can reach you all now. I understand there's a hotline. Tell us more about how people can reach the American Cancer Society.
Yes, certainly. We have a 24/7, 365 days hotline. It's 1-800-ACS 2345. And you will get a live specialist each time that you call. And not only patients call, we have caregivers, we have family members, anybody that has any question, whether it's about cancer, whether even now, coronavirus concern. With your cancer. There's also a live chat if you prefer that on cancer.org. So there is different ways that you will be able to get a live person 24 hours a day, 7 days a week, um, uh, using these methods.
Great. And shifting gears just slightly, I want to give maximum time to prostate cancer because we do hear so much about breast cancer, right? Women do a great job of getting the message out there, but oftentimes men are ashamed of having prostate cancer. But going back again to breast cancer, tell us about just a little bit, Denise, about the screening that's available in St. Croix and the Virgin Islands for breast cancer, mammograms, etc.
Yes. So during the month of October, there is an opportunity to receive free screening mammograms via grants from the American Cancer Society. So in St. Croix, you can call Juan F. Luis Hospital and ask for the mammography suite. and they'll give you additional instructions how you can sign up for that program. In St. Thomas, Schneider Regional Medical Center, you'll need a referral from your doctor or one of their clinics, and then you can call them and ask for scheduling and let them know that you want to be a part of that program, and they'll give you additional instructions. And of course, also in St. Thomas, we have St. Thomas Radiology. You can also reach out to them. All of these mammograms, again, are free of charge. So that's for starting in the month of October.
That's excellent. I understand also, maybe you know about this, but I understand that the mammogram equipment on St. Croix at the Wong F. Louis Hospital is some of the greatest and latest technology. So it's wonderful that we have that right here in St. Croix.
Yes. And that's part of our commitment. We need to address the access to care. We want to help people early detect if they do there's any findings. And my messaging to everybody that's listening to us and looking at us today is that COVID has stopped, but cancer hasn't. So we need to do our checkups. Don't be scared of the COVID. All these medical centers are taking all the precautions and safety to make sure that you could do your appointment and have your screenings done and your treatment. Don't stop your treatment. Don't stop your checkups, because between early detecting something and surviving cancer at an early stage. So please make sure that you call the American Cancer Society. We're there for you 24/7, and we're here to support and provide you access to service.
Great. And as we're coming toward the end of the show, again, I want to let our audience know, as we have mentioned several times, that the American Cancer Society and AARP in the Virgin Islands has just formed. Actually, we're still in the process of officially forming a wonderful community partnership. And we want to hear so much more from you in the near future, because as you mentioned, cancer is at a very high rate in the population that's 50 years of age and older. So it makes sense for AARP and the American Cancer Society to team up. And we've done that all across the United States.
Yes.
Between AARP and the American Cancer Society. So we look forward to having you back on the show many more times in the future. We only talked a little bit about prostate cancer today, but there's so much more we have to discuss regarding cancer. So I thank both of you for being with us, and any closing words in our last 30
Well,
seconds.
once again, thank you. And we're very proud. The only way of meeting our goal of saving lives is through partnerships and collaborations and messaging and making sure that people, when they listen to us, once again, I'm not here to do an awareness campaign. I'm here to ask you to take action and go and for your screenings and take care of your health.
Great. Thank you again both so much, Lillian and Denise, for being with us, and we look forward to our next conversation in the near future.
Thank you for
Thank
the
you.
invitation.
Welcome. Have a great day.
You
You
too.
too.